welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I will be taking you all to explore the world of rare diseases. And my topic for today will be osteopetrosis. Now, to give us an in depth knowledge about this, we have with us today Dr. Muhammed Nazeer, who is an expert in joint replacement, arthroscopy, pediatric orthopedics, and even trauma. He is the senior consultant and group coordinator at KIMS Health Trivandrum. Welcome to Medical Dialogue, sir. It's really a privilege to be interviewing you here today.
Right. Thank you. I'm very happy to join you to share my knowledge. Thank you.
Great, sir. So now that you're talking about rare diseases, and as we mentioned, it's about osteopetrosis that we will be discussing today. Firstly, if you can just provide us an overview of osteopetrosis as to why is it considered a rare disease, and also if you could just highlight its main characteristics.
Osteopetrosis is a very, very rare disease that occurs in almost 1 in 250,000 people, and it is otherwise called as a marble bone disease. The problem with this condition is basically you have in the normal bone, when there is an osteoblastic activity, that means when there is a bone formation takes place, simultaneously there will be a bone resorption which also takes place. So that is what is happening normally. But in osteopetrosis, which is a genetic condition where the osteoclastic activity or the bone resorption won't take place. When there is no bone resorption, what happens is that whatever the bone is deposited as the bone formation occurs, it will not get resorbed, and the bone becomes so thick. That doesn't mean the bone is so strong. It is just like a chalk. You know the chalk, when you use it, when the teachers use it, you can break it easily, even though it is completely looks like that if it is strong material. Similar to that, the bone also breaks. That is the main disadvantage of this osteopetrosis. And we have different types of osteopetrosis. As I mentioned before, it is something which is genetically transmitted, and there are different modes of transmission that we'll be discussing in the next few slides.
Great. So that was a very brief overview of why is it considered to be a rare one. So if you could just explain to us what are the different types of osteopetrosis and how do they vary in terms of severity and also its symptoms.
Osteopetrosis, as I mentioned before, it is a genetic disease. Genetic disease in the sense it can transmit from the parent to the offspring in different ways. One of the way is called as autosomal dominant. Autosomal dominant, where the disease is transmitted to the offspring, but the symptoms are less there. Actually, those patients will survive without much problems, except there are fractures which occurs in the later part of their life. But there is another two varieties. That is, one is called as autosomal recessive one, and it is a very, very rare, where the child may not survive. Maybe few months, maybe intrauterine death can occur, or maybe few years. And there is another very, very rare variety, is the X-linked variety, which is transmitted through the sex chromosome, where also the condition is very, very serious and the child may not survive. These are the different types. You get a simple variety, you get much severe variety, and an intermediate variety.
Okay, noted. Now, sir, what causes osteopetrosis? And as you mentioned, it is primarily a genetic disorder. Apart from that, are there any causes that one must know about?
No, actually, there is no cause we can say. It is genetically transmitted. It is mainly because what happens when the genes are transmitted from the parents to the offsprings, there can be some mutation which takes place. Because of the mutation of some particular genes, this condition occurs. That is the main reason. So we can't say any other reason.
Okay. Now, sir, coming to the next aspect, you mentioned its causes, its clinical features. Now, coming to the diagnosis aspect of it, are there any imaging tests or any other diagnostic tools that one can use to diagnose this condition?
The main diagnosis in this one is the clinical features. As I mentioned, these children usually when they born, they may have some sort of fractures without much trauma. Even if there is a trivial trauma, they can get fractures. And also the other clinical features such as the child can get some sort of cranial nerve palsies, some sinus obstruction. The sinusitis, the sinus obstruction can occur in these children because of the dense bone, and these children often have the dentigerous problems. So that means the teeth is abnormal. There can be malformation. There can be defective ossification, or there can be caries, which occurs so frequently in these children. That is one of the major things which we make this diagnosis clinically. And then you can take an X-ray. A plain X-ray will show that there is lot of the bone density is very, very high as compared to the normal bone, and there is no intramedullary space, which is very obvious in the normal bone, which is completely absent in this children. That is one of the main cause, and the main tool for diagnosis. And the next thing is you can do some blood tests. There will be a raised alkaline phosphatase, acid phosphatase. That is also one of the tool which we can diagnose this condition.
Now coming to the next aspect, that is the treatment part. How do you approach the management and treatment of fractures in patients with osteopetrosis? What management techniques can one must do?
Yeah, it is. Of course, it is almost the same as you treat a normal person, but certain things you have to be very, very careful. One thing is this children's fracture. This children fracture can be managed conservatively with the use of splints or some sort of immobilization. And also these fractures can be treated with open reduction and plate and screw fixation rather than putting intramedullary nail. That is one of the very, very common modality for treating long bone fractures. That may not be feasible in these children because the medullary cavity that means that is there inside the bone. It is very, very narrow, and that you may not be able to manage with that. And another issue is these children can get infections very, very frequently. The reason being the bone itself is a hemopoietic tissue. That means the blood formation takes place in the bone. That is not happening in these children. So these children will have the number of the blood cells in the body is very, very less. That we can say that there is a very less number of white blood cells or red blood cells or platelets, and they are very, very prone to infection. That also we have to take care.
Okay, noted, definitely, sir. Now coming to the discussion of role of bone marrow transplants. So if you can just give us a few insights on the role of bone marrow transplants in treating severe cases of osteopetrosis.
That is one of the advancement that we have now. That bone marrow transplant, we don't have much to treat these children. It was not there before, but since the advent of the bone marrow transplant, there is a light which is coming towards the treatment part, that these children can be saved to a certain extent, especially in the severe cases. You can do bone marrow transplant, and that will help these children to have a better blood cells in their body to prevent infection and to survive.
Great. So recent advancements, if we talk about it, that bone marrow transplants is definitely something to look forward to. Now, how does osteopetrosis impact the overall quality of life, and what supportive care would you recommend for such patients?
Yeah, their overall life is you can say that it's a miserable. That is the main reason, is that they get very frequent fractures, and they have the pain sensitivity is there. That pain sensitivity, because of the pain sensitivity, they will suffer with these fractures, and their as I told, their blood cells will be very less. They can get very frequent infections, and life expectancy as such is very less as compared to the normal people. But these children have to be supported very well, and you can use splints, you can do whatever supportive measures you can do to prevent the infections. They have to be taken away from the environment. where you get frequent infections. This can be done.
So, thank you so much, Dr. Muhammed Nazeer, for joining us today at Medical Dialogues and giving us all your valuable insights on osteopetrosis and how rare it is and what one must look out for and what modifications or advancements that one can have for treatment of such conditions. So, thank you so much for joining us today at Medical Dialogues.
Thank you. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.